the leading cause of hospital admissions and mortality in the Lake Basin region. But the coming of malaria vaccine is changing the health indicators in this area. My name is Beldin Walieula, and on this week's episode of Health Digest, we focus on the uptake of malaria vaccine in the country. Busia County is part of the Lake region where malaria is endemic and the disease prevalence is high. At Busia County Referral Hospital, we meet Eunice Buluma, whose 4-year-old grandson came here convulsing due to severe malaria.
Kurudi by saa 6, wakaniita mtoto kuna malaria, analala tu chini hata kucheza na wenzake. Kweli nikaenda nikamchukua, nikaleta nyumbani. Kuweka kwa nyumba, nikamlalisha kwa kiti ili nipate pengine nimpe madawa. Nikasikia analia. Anapiga nduru, ati tumbo, mama tumbo, kukuja kweli anatoa jasho, mwili ni moto kila mahali. Nikamubeba. Kubeba, kuweka hapa. Shingo ikachapa shingo ikaenda side moja. Tena kurudisha hivi tena ikaanguka side moja. Najaribu kusimamisha hawezi. Kukalisha chini ati nichukue hata nguo basi nifalishe. Anaenda kila mahali. Harakati hiyo nikachukua boda, nikakimbia kwa dispenser yenye ilikuwa karibu Madende. Kufika pale wakasema hapana, enda Nambale.
Since he was in a critical state, she was referred here for specialized care.
Madaktari wameshughulika naye, wakanielezea peleko wapige picha kichwa, nikapeleka. Wakapiga x-ray, wakatolea damu ya mgongo, maji ya mgongo. Na naona lakini vile nilitoka Nambale alikuwa ameisha. Hata mimi alikuwa amejiuma, haoni. Hata hawezi tingishika, hata wakidunga shindano. Sasa tuseme last week, alafu hii ilikuwa Wednesday, nikaona sasa napanua mdomo kidogo. Akaanza kama hata wakidunga shindano nasikia uchungu kidogo na niweka ndani. Sasa naona natoa sauti, lakini kuongea ongei. Alafu shingo ndio naona bado uchungu, hii shingo bado inaenda.
But not everyone lives to tell the tale of malaria. It has left unhealed scars in many families in Busia County. Beatrice Nabuire recounts how she lost her grandson to malaria.
Sasa ilifika saa 4 ya usiku, nikasikia analia, nikaenda kwa room penye wanalala. Nikamshika, mwili ni moto, imerudi sasa tena kuwa moto sana. Nikajiuliza sasa saa hii usiku sinago tu namna yote ya kufika Madende. Madende ni mbali, nahitaji pesa.
She was later referred to Busia Referral Hospital where his grandson died.
Kufika Busia kwa gate hivi nikaingia, kweli daktari akaniona mtoto ako vibaya sana. Akanipeleka paka kwa wodi. Akaniambia enda tafuta file. Wakaanza kujaribu kumhudumia. Lakini sasa hata haikuwezekana. Kumbe malaria ilikuwa imemlemea kabisa. Na kumaliza tu kuchukua file, nikarudi hapo kwa kitanda penye mtoto alikuwa, mtoto akaaga.
It happens that Busia County, most cases reported are of severe malaria that is accompanied by convulsions and anemia. At Busia Referral Hospital, there is a whole ward set aside for children with severe malaria.
If I talk of, if we admit 10 children in a day, it means 6 of them have malaria. Because when we do our quarterly reviews, we have of the disease burden as a unit. We get malaria comes just immediately after pneumonia. And the difference is not huge in that if we have admitted a number of 320, because we are between 280 and 320 in a quarter, then it means if we had 320, then like almost 150, 180 were malaria cases. Yeah. So despite for Mataya sub-county, we don't have malaria vaccine being given, but it's being given in our neighboring sub-county, that is Nambale. But we have other supportive activities that are taking place. We have the nets.
Treatment of severe malaria takes more time and resources for a child to recover. One of the biggest challenges.
When we are talking of severe malaria, most of our children, they'll come in presenting with a fever of above 38.5. Usually the AVPU will be less than, that is the consciousness. It will be less than A, that is alert. The children, either they can only respond to a voice or pain, or they are unconscious. Yeah, and then we are talking of their vomiting, like vomiting everything. They will be vomiting, and then they are in distress, respiratory distress. Actually, if most of the time they come in the referrals or even the walk-in, that is, they have been referred from our MCH.
With the big malaria burden that Busia Referral Hospital bears, the hospital faces frequent stockouts of malaria treatment regimen and blood that is mostly needed by children who present with anemia.
Bringing in the children is taking too long, yeah, because this child will present to our peripheral sites with febrile convulsions, yeah, and either because of supplies or because of ferrying them here, it takes a while. Like they can go to the hospital, now it is 9, and then by the time they reach to us, it's 5, and this child has been convulsing. Yeah, and so we end up staying for them for so long. Actually, tonight it increases even the hospital burden because it has to stay with that child all that period. They are unwell. That is one. Our referral system has not been streamlined well. And then the issues of fuel. Yeah, the child can go there. We are willing to bring them to hospital, but how do we take them there? We are talking of far ends like Budalangi. They are sick. The officer there has noticed that this child, for us here, we are not going to do it. Let us refer this child to Busia. But how do they reach here? It is a challenge. Yeah? And stockouts. Once in a while, we are having stockouts, and they are really affecting us.
Most hospital admissions and hospital visits in Busia County are due to malaria.
Following the Kenya Malaria Indicator Survey 2020, Busia County is the leading county in Kenya with the highest number of malaria cases at 39%. That means that if you randomly test anybody in Busia today, 39 people will have malaria out of every 100 people. So if you take the population of Busia to be 1 million, that means 390,000 people, as we talk now, have malaria. Now, that's what we call the Kenya Malaria Indicator Survey's findings. But now, as per our regular monthly statistics, for every 100 patients visiting any hospital in Busia County, 4 of them will be tested and confirmed to have malaria. 40 out of 100, that's 40%. If you go to the wards, any ward now in Busia County, 11 out of 100, 11%, will have malaria. That's what we call an average. But if we visit a specific facility like where we are now, Busia County Referral Hospital, which is our referral center, 6 out of every 10 children in the ward now have malaria. And most of them are referred there having very severe symptoms of malaria. Severe symptoms include things like convulsions, severe anemia, and the rest. And unfortunately, for every 100 deaths in Busia, 2 deaths are caused by malaria. For every, that means 2%. For every death, deaths include road traffic accidents, all those deaths, old age, 2% is from malaria. So it's very unfortunate that we still get malaria that kills our people.
In 2019, Kenya pioneered the use of the malaria vaccine in some sub-counties in the Lake endemic region. To date, Over 750,000 doses of the vaccine have been administered to children in these counties. 275,000 Kenyan children have received at least one dose out of the 4 scheduled doses of the vaccine, while over 45,000 children have received their full course of 4 doses of the vaccine.
If the malaria vaccine can be used, can be used through the routine immunization. Then number 3, if it's causing complication. Then number 4 is how is the uptake compared to other vaccines. I'm happy to report that from our data, the uptake of malaria vaccine, dose 1, dose 2, dose 3 is very good. It's comparable to other vaccines, be it pentavalent, pneumococcal vaccine and the rest. But however, the 4th dose, the uptake is a little bit reduced. Compare the 3rd dose and the 4th dose. The 4th dose is much less. We don't know the reason why, but it is, and that's where you need another operational research. But it's hypothesized that because the 4th dose comes at 2 years and the children come for their last dose of measles at 18 months or some come at 9 months, because there's no any other vaccine around that period.
The malaria vaccine is given simultaneously with other childhood vaccines in 4 doses, where the last dose is given when a child is 2 years. In 2021 alone, 9,633 children received their first dose of the malaria vaccine in Busia County. The health volunteers in Busia County have been trained to test and treat malaria by non-governmental organizations such as Amref Health Africa. The community health volunteers are also tasked with referring severe malaria cases to hospitals.
Kuna cases hata saa zingine naitwa usiku. Wenye wanaweza kuja wanibebe na pikipiki tukuje, ama wanipe escort mpaka kwa boma. Kama huyu mama kuna wakati aligonjeka malaria, kijanake wa hii nyumba alinikujia usiku kitu kama
Simama hivi. Simama tu
hivi.
Lakini ongeenda huyu.
Sawa. Walikuja wakanibeba kwa pikipiki, wakanileta hapa, nikatest mama, nikapata ako malaria positive, nikampea dawa hiyo usiku. The following day nikafuatilia, nikaona akona changes.
At this facility in Viwa constituency, we meet Anyango, a mother of 3. She tells us her second born was prone to malaria infections, and this made her take the initiative of ensuring her youngest daughter is vaccinated against the disease.
Chanjo tulifundishwa na naitwanga aje CHVs. And then sasa ukikuja hapa clinic pia wanapeana health education. Sasa from there unapata information. So niliamua tu apate tu chanjo. Okay, mtoto akona miezi 10. Chanjo ya kwanza alipata akiwa miezi 6. Ya pili akapata kama ako 7 months. Na ya tatu akapata 9 months.
Anyango advises other mothers to embrace malaria vaccination.
Mimi niliona kama ni mingi, but after umefundishwa na hii kitu wanasema eti walishafanya experiment. Sasa kama venye walifanya experiment haikuenda vibaya na wao, mimi niliona ni sawa. Sana sana ilikuwa ni izuie hiyo malaria, sababu kabla ya malaria ikuje kuna ingine ilikuja kuzuia kuhara, na niliona ilisaidia. So hata hii niliona itanisaidia.
Homa Bay County is also facing challenges with the uptake of the 3rd and 4th doses of the malaria vaccine.
The uptake has been well, except for the 3rd and the 4th dose, where we are still struggling. But we put in measures to ensure that we get these children come back for the 3rd and the 4th doses. Yeah.
Maybe just go by numbers in our town, view and school.
I have the number for the entire county. Yeah, so far we've been able to see for first doses, we are aware we are giving fourth doses or 4 doses. So first dose we've been able to give 30,895. Second dose 25,224. Third dose 19,488. Then fourth dose 3,038.
Okay, in 2015, the prevalence of malaria was 27%, and that is based on the Kenya Malaria Indicator Survey that is done every 5 years to inform our program. And then the last survey was done in 2020, and the prevalence went down to 3.6%. Yeah, so this is based on a number of interventions, not only malaria vaccine, but malaria vaccine also had a greater impact on it. Yes.
Does the county any other interventions that you are rolling out?
Oh, apart from the malaria vaccine, we implement vector control interventions that target mosquitoes, like indoor residual spraying and spraying of the houses where mosquitoes normally rest. And then we also have use of insecticide-treated mosquito nets. We also have larviciding, where we spray areas where mosquitoes give birth. We also have use of drugs to prevent malaria in pregnancy. Yeah, what we call IPTP.
Community health volunteers have come in handy in Homa Bay County, especially in contact tracing of mothers who have not presented their children for the 3rd and 4th dose.
We are putting in measures to ensure that they get back to the facility. One of the measures we put is we have defaulter tracking booklets. So we generate a list of defaulters. Then we give to the community health volunteers to be able to trace the mothers back. Another mechanism we are using is phone calls. In our permanent register for immunization, we do have phone numbers. So unfortunately, some of the mothers or the caregivers, we cannot be able to reach them through their numbers, and therefore we engage the CHVs or the community health volunteers to be able to do that. Yeah.
With interventions like the use of insecticide-treated mosquito nets and the introduction of the malaria vaccine, the prevalence of this deadly disease is said to be going down. The 3rd and the 4th dose of malaria vaccine are facing some challenges when it comes to the uptake. But with more sensitization, this could change. Building Waliaula, KTN News in Homa Bay County.